This is Dr. Hope with Mercy Grace Medical Aesthetics. Welcome. Today we're going to be talking about basic skincare routines. Now, I've gotten some questions from some patients who say, why do I need a skincare routine? Who has time for that? And then there's some people who have a whole laid out routine, which is their self-care. I think that's amazing. But today I'm going to be delving a little deeper into the why of the different aspects of a skincare. At the very basic, you would need at least a cleanser, a moisturizer, and sunscreen. But let's start from a cleanser. A cleanser is basically what you're going to use to take off dirt, makeup, oil, grime from the day. And the type of cleanser you use will depend on your skin type. Soaps are typically harsh unless it's actually a soap that's formulated for the face, then that's different. Generally, body soaps are formulated a little differently from facial soaps, and so they may be harsh on your skin. If you have dry skin, which I do, you want to use a cleanser that's gentle, that's not going to strip away the oil that you so desperately need. And if you have oily or acne prone skin, then you want a cleanser or a gel, like a foaming gel, that will actually have little or no oil, so that way you don't put more oil on your skin because you're already overproducing oil, but you can still get the dirt and the grime and the makeup off of your face. So cleansers are important, and while you're cleansing, you want to do a little bit of massage to your face, get the blood circulating around your face, and massage your muscles and do some muscle movements to wake up those muscles and move them around, and just kind of massage into it. Yeah. The next thing a lot of people talk about is, do I really need a toner? What do I need a toner for? Used to be that toners were used to generally balance the pH of the skin, especially because people used, harsh soaps for their face. Now, a lot of the cleansers rather that we use are better pH balancing. So toners are generally to get rid of any extra cleanser on your face, any extra dirt, but it still helps balance your skin. Some toners will refresh your skin and kind of give you a zing and a zest and wake your skin up in the morning. So a toner is not a bad addition. You don't have to if you don't want to, but a toner is not a bad addition. Sometimes it comes with extra products in it that actually nourish the skin and benefit the skin. So that's another step, but again, that's optional. Now, the next step would be the moisturizer. Now, for some people, especially if you have acne prone skin or you have oily skin, you want to be careful here, because if you use a moisturizer that's a thick cream, that could actually add more oil to your skin, and that could worsen the acne on your skin. You may want to do a thin lotion, facial lotion, or you may want to do a serum. What's a serum? People ask, what is this? What's a serum? So serums are typically concentrated oils that usually will contain more higher performing ingredients in them. They're usually very nourishing, or they may have specific ingredients to address specific concerns. I'll give you an example. Vitamin C serum is one that contains vitamin C, which is an antioxidant, and that's very beneficial in actually helping combat photoaging of the skin, as well as helping to brighten the skin and helps with pigmentation of the skin. You can also have some serums that have peptides in them that help reduce the look of wrinkles and fine lines in them. So serums can be an addition to your routine, especially if you want to target specific concerns. Some of them are just helpful to just keep your skin radiant and young looking, because they have ingredients that will help plump up the skin and help with collagen production. So they're a very good added benefit. But again, if you're like, just give me the minimum that I need, then you want to choose a very good moisturizer depending on the type of skin that you have. Some people need creams for the eye, specifically for concerns like puffiness or lines around the eyes, the fine laughter lines, or the wrinkles. And so you could get specific eye serums for that, before you put your moisturizer on, if that's what you want to target. Some of them come in a gel form. Some of them are leave on, and some of them could be one that you put a gel on after you've cleansed, and then you use your toner to take off, and then you put your moisturizer or your facial lotion. After the moisturizer, there's one more step. Sunscreen. A lot of people are like, really? Why? Guys, photoaging is real, and sunscreen helps with reducing the impact of the ultraviolet rays from the sun. The rays affect the epidermis as well as the dermis, depending on what ray it is. And if it goes into the dermis, that's the UVA rays. If it goes into the dermis, that actually can over time cause sagging of the skin, which we see in aging. And the epidermis, which is a superficial layer of the skin, that can cause wrinkles and fine lines and all the skin cancers that can occur with the skin. That's the UVB rays. The UVA rays can cause melanoma, which is another type of skin cancer. So sunscreen is important, very important. So at the very basic, if you're like, okay, all right, Dr. Hope, give it to me. The bare minimum, what should I have? Cleanser, moisturizer or serum, depending on your skin type, and sunscreen. Bare minimum. Let's start with that. Now, if you're like, okay, all right, I got it. All right, Dr. Hope, what would you recommend in addition? I'm glad you asked. Then you want the ABCs of skincare. Now, the B we've already talked about. That's the broad spectrum sunscreen that will target both the UVA and the UVB rays. The A is your vitamin A derivative, which is the retinoids. Now, tretinoin, one of the vitamin A derivatives, is actually the gold standard for treating photoaging. And there are different forms of vitamin A derivatives out there. You want to, if you've never used a retinoid of any form, you want to start with the lowest strength, and you want to start slow, meaning twice a week. Space it out, maybe Mondays and Fridays, so to speak, and then maybe 3 times a week, Monday, Wednesday, Friday, so to speak, for example. And then see how you do. Is that where you need to stop, or can you do it every day? Now, the retinoid, the vitamin A derivatives, are best applied at night because they are photolabile, and so they get disintegrated easily in the sun. So they usually apply just once a day, and that's at nighttime. And you only need a really small amount all over the skin, but they actually are great for photoaging. Some of them can be formed with other ingredients, or can be formulated rather with other ingredients, so that they can address other specific concerns like acne or hyperpigmentation. So that is, if we want to step it up a notch and you say, okay, all right, I have the cleanser down, I have the moisturizer down, okay, I'll do the sunscreen, give me one more, then I'd say a vitamin A derivative, and that's at bedtime. Did you ask for another? Okay, the C, you asked for another. I heard you. So the ABC, if you're like, all right, Dr. Hope, this is the last one. After this, don't talk to me. The C is vitamin C. Why do we need vitamin C? Because it's a powerful antioxidant on the skin, and it helps with a lot of concerns that a lot of us have, which is pigmentation of the skin and photoaging. So vitamin C is an additional benefit that you can actually give yourself for your skin. So in a nutshell, this is like just an explanation of, okay, why do I need all these things in my routine, and what's the benefit, or what's it going to do for me? So just a little basic. You always want to talk to your skincare professional about your skin concerns and then see what recommendations they have and then go from there. So till next time, remember to look after yourself because you matter. I'll see you next time.
Storyblocks Audio.